Hi everyone, welcome back to our live session for reviewing the NCLEX RN exam. If this is your first time joining us, we are currently on day 21 of our 90-day NCLEX review series, which is completely free. And throughout this series, we are covering a broad range of nursing topics and tackling 2000 NCLEX questions with the detailed explanations. And so spread the word to your friends preparing for the NCLEX. Our classes are free of charge. And don't forget to subscribe and enable notifications to stay updated with our latest content. And for more details, check out the description box below. And your feedback is so valuable to us. Please share your thoughts or questions in the comments, and we'll gladly provide further explanations on any topics. Now, we also invite you to enroll in our NCLEX review course, so visit at our website at www.stancoastnclexcoaching.com for personalized support. And the program aims to make your studying enjoyable and featuring engaging lectures and also a vast collection of over 3,000 NCLEX style questions. And you can explore in our 10-hour animated video course and also gain access to about 100 hours of preparation time. So you can also utilize our on-demand video library and practice with mock exams to boost your confidence. And this is something that you can access for a full 6 months, including over 200 NGN test questions, and you'll be thoroughly prepared for the exam. So you can study at your convenience with our flexible platform, and we are committed to assisting you every step of the way. And today, guys, we are going to talk about the nursing management for a patient with pulmonary tuberculosis. So let's go right ahead. Now, reviewing about the tuberculosis concept, this is basically one of those infectious illnesses that is caused by the mycobacterium tuberculosis, of course, and this is going to be spread via the airborne droplets. And this is going to primarily affect the lungs, and it can impact really the other body parts. But our focus for today is only on the pulmonary manifestations. So currently in the US, the incidence of the tuberculosis was approximately about 2.6 cases per 100,000 of people in 2020. And so the rate reflects really a gradual decline over the years, although the TB remains a concern, especially among the high-risk groups. But the overall trends show the decreasing incidence and also the rates across the country. But we're going to talk about now the pathophysiology and how the TB spreads. Now, reviewing with that is we're going to start with how the Mycobacterium tuberculosis, which is actually a fungus-like property, and this is slow growing. It's actually the acid-fast aerobic bacteria that can be eradicated by heat, also sunlight, and ultraviolet light. Okay, so this is really a slow growing, like I've said, it's fungus-like property. Now, this is something that can be spread from an infected person through coughing, talking, also sneezing, even singing. And when these are being inhaled by the susceptible individual, the bacteria will now travel to the lungs, and this will lodge into the pulmonary alveoli, right? Now, if we are going to possibly test this patient, probably within a time frame of 2.5 weeks to 12 weeks after the exposure and infection, then the PPD or the quantiferin will actually turn positive. And although most of the infected individuals do not really develop the manifestations, and it's because of some immune control, but some of these individuals will really have some manifestations already. And some of the bacteria may also can remain dormant for several years, such as in a latent type of tuberculosis. So that's what we call as the LTBI, where the individual will really have asymptomatic period. Okay, And so they are not also contagious at that point when they have that kind of the latent type of tuberculosis infection. Now, talking about the different high risk groups, then these are the persons that could be in close contacts with those persons with active TB, or maybe for those people that were travelers from high prevalence regions, let's say Africa, Asia, Eastern Europe, or it could be Latin America or Russia. And also for those people that are living in crowded environments, for those who are in the long-term care facility or nursing homes, could be prisons, could be shelters, they are at risk to contract this infection. Now, the healthcare workers, nurses, and anyone in the hospital as employee, if they are going to be exposed to these people who are high risk, or if they are infected with the TB, then they definitely can contract this infection as well. And also for those children or maybe adolescents that are in contact with the high risk adults, then they are really prone to getting this infection as well. Now, with the TB control in the US, it has been quite challenging because of the high prevalence among the foreign-born residents, and also the delay in the diagnosis and also the reporting, and also the gaps in identifying and also screening at-risk persons. And for those who are particularly with the latent type of TB, okay? So with that at-risk population as well, we are talking about the let's say those people that had the HIV, and also for those people that are infected with TB in the last 2 years, for those children that are under 4 years old, for those individuals that have some immunocompromised. So we have those patients like the silicosis, for those people that have diabetes mellitus, chronic kidney disease, could be leukemia, could be some lymphoma. And for those people that are malnourished, underweight individuals, and again, for those people that are taking in long-term corticosteroids, or for those people that are taking the anti-rejection medications, for those who had received the organ transplant. So they're really at risk to contract the tuberculosis. Now let's talk about the pathology, about how the tuberculosis will progress after it's being inhaled inside the body. Now, it's going to start with the formation of the lesion, all right? So when somebody inhales the Mycobacterium tuberculosis, this can really travel deep into the lungs and will invade the lung tissue. And when this happens, guys, the body's immune system will now respond by sending the immune cells, let's say the macrophages, in order to attack the invading bacteria. And this can now lead to the formation of the clusters, let's say infective cells and immune cells. So these are now going to cause the formation of the lesions or the tubercle in the lungs. Now, moving forward here, the pathogenesis will proceed with the formation of the granuloma. So what is this? This is basically the immune system that is trying to contain the infection, and it will form this structure, a granuloma, and this will be wrapped around the tubercle, okay? So basically the tubercle or the granuloma itself, it's like a wall of the immune cells. It's also composed of the fibroblast and also the collagen fibers that will actually encase the bacteria. And so this is an attempt of the body in order to prevent the microorganism from spreading further into the other body sites, okay? Now, as we're gonna go look into the inside of the granuloma, well, the bacteria there can remain dormant, or we should say like they're inactive, or they can also grow slowly. Okay. However, though, this will also lead into the development of, let's say, necrosis or liquefaction, also the sloughing off, or let's say the formation of the cavity. And so this will move further into the cell tissue death, wherein it will have that kind of like cheese-like necrotic core. And so this is really gonna end up dying. I mean, the tissue or the cell will end up dying, and it's because of the lack of the oxygen or the blood supply, or even the toxic effects of the bacteria itself can cause the cell to die. Now, the liquefaction will also happen, wherein this will now lead into this kind of like caseous, cheese-like necrotic material. It will now liquefy over time, and it will turn into a semi-liquid type of a substance. Now, with that, the granuloma will start to break down, and it will now spillage of the necrotic material. And it will now further go into the sloughing, and also the bacteria or the granuloma wall itself. Again, the granuloma wall will now try to weaken, or it will start to weaken, it will break down, and then the liquefied necrotic material will now spill into the surrounding tissue or the airways. Now, when that happens, it will now create that cavity or a hole. When that liquefied material drains outside, and it can leave that hollow or a cavity inside the lung tissue. Okay, so that is why it's the last stage we're in. It's now the medical provider, upon seeing the chest x-ray, they're going to see those holes inside the lung tissue. Now, we'll talk about the different assessment findings in a patient with TB. And so some of these patients may not have any symptoms at all, or maybe they will have some subtle or maybe some manifestations that can be easily overlooked. So most of the general manifestations that we can look into this patient would probably include some fatigue, of course, the anorexia. There will be loss of weight. There is also going to be some low-grade fever, night sweats, and the patients will also experience acute fever, chills, and some flu-like symptoms. Now, guys, take note that the pulmonary symptoms can progressively include some productive cough. Maybe they can have that mucoid or mucopurulent type of sputum, or maybe it's going to be mixed with some kind of blood. And they're also going to have that chest pain and a shortness of breath. Now, in some cases, we're in such a case like extrapulmonary TB. This can also cause pain, inflammation, and also the dysfunction of the affected tissues. Now, let's move forward with how the medical provider will detect or diagnose the TB. Well, we have the top of the list here, which is basically the sputum sample, in order for us to identify that microorganism through the acid-fast bacilli. So this is a procedure that is commonly done in order to get that microorganism identified. And per the CDC guidelines, there should be at least 3 samples that can be collected at least 8 to 24 hours apart. Okay, again, so the collection of the sputum sample can be at least 3 batches, and this is going to be collected at least 8 to 24 hours apart. And one of the tests, one of the collected sputum specimens should be done early in the morning. And definitely the sputum sample can also guide the decisions, especially with the result. This can also guide in discontinuing the isolation in the healthcare setting, if in case the person is not positive, right? And so with the diagnosis, or let's say, for example, if the doctor would probably the diagnosis in itself would really require at least 3 consecutive positive smears and other clinical criteria in order to maintain that the patient has tuberculosis diagnosis. Now, the positive sputum culture can also confirm that the patient has active tuberculosis, and it can also give us some idea if the patient has the drug-resistant type of strain. Okay. Now, the next testing that we have is the chest X-ray, which is going to assess the presence of the TB and also the extent of tuberculosis. It can give us some idea on just looking into the X-ray, and also that tuberculin skin test, or the PPD, or the Mantoux test. So these are valuable tests that can detect the TB infection, of course, with injection of that purified protein derivative, about 0.1 ml, that is given intradermally. And this is going to be read within 48 to 72 hours. Again, the PPD is injected with that amount of 0.1 mL, and this is going to be read within 48 to 72 hours. And here's the thing though, because there are different sizes or in duration that you need to really understand, because there are different variances here with the different in duration. So let's take a look on here. So for example, if the person has an in duration of 5 millimeter, this is already considered as a positive, or telling us that the patient is positive for TB if they have, or if they belong to the high risk group. So for example, if they are HIV positive, or let's say if they are immunocompromised, and so when they are getting that 5 mm in duration, they're already considered positive. However, though, if the in duration is at least 10 millimeters, okay, so this is going to tell us that the person is positive for TB if they belong to this category. Maybe they are recent immigrants, drug users, or let's say they're individuals that have been exposed, or let's say they are a laboratory personnel that is exposed to these infectious substances, or let's say for those children that are considered high risk. And so with that 10 millimeter in duration, they're already considered positive for TB. Now, if in case their in duration is about 15 millimeters, so they are considered to be positive for TB if they do not have any known risk factors for tuberculosis. Okay, so these are those people that have been in the US for quite some time. They don't belong to any of the risk population, and so this is their positivity criterion, 15 millimeter in duration. Now, talking about another testing here is the nucleic acid. Oh, here we go. The person that may have received the BCG, or the Bacillus calmette-guerin, this is the immunization that most people will receive in Asia, or let's say in other parts of the world. This can also lead to a false positive PPD testing, okay? And I can attest to that because I had the BCG immunization, and when I was tested for the PPD, I was positive, but when I was had some more testing done, I was actually negative, and I had annual chest X-ray done. And that is something that the employee can do. They just want to make sure that they're going to go through symptom review every year, and every 2 years you're going to have to undergo chest X-ray in order to check if there is any change or if there is an active TB going on. All right, so again, if you receive the BCG immunization, then it can cause this false positive reading. All right, now moving into the next testing here, which is the nucleic acid amplification, or known as the NAAT, or the NAT. So what is this testing? This is basically a diagnostic tool that will also detect the Mycobacterium tuberculosis infection, of course, it will collect that DNA in the patient samples, let's say in a form of a sputum, or it could be urine. Okay, and so the test itself will work by extracting and also amplifying the TB DNA using the PCR method. Okay, so when they are gonna see positivity when they're using the nucleic acid amplification test, well, of course, it indicates that the person has positive TB infection, and this will really require the medical provider to prompt treatment initiation. And one of the advantages in this kind of testing is that it can give us faster results compared to the traditional methods, let's say the sputum or the tuberculin skin testing. And so this is really going to aid in a much timely patient management and also disease control. And lastly, we have the quantiferin TB gold blood test. Again, our specimen here will be through collection of a blood sample. And this is a test that can substitute or can become an alternative to the PPD. However, the disadvantage is that it doesn't really differentiate whether the patient is an active or has a latent type of tuberculosis infection. Okay, it does not distinguish between active or latent TB. And so when the person has a negative test result from the quantiferin TB gold test, then this should be carefully interpreted in immunocompromised individuals. And so making sure that the patient is cleared, making sure that they are identified, maybe they belong to the high-risk groups, or if they are in the category of children or adolescents, then definitely that has to be part of the screening as well, making sure that it's not, there will be a reduction in misdiagnosis of this patient. Now we're going to talk about the treatment of TB. And so this is really going to involve a combination of medications that can possibly, what do you mean by what was full form of PCR? What does that mean? The full form of PCR, are you talking about the kind of testing? That's the nucleic acid amplification test. That's the NAT. Okay. So again, this is going to include the collection of that sample, the DNA sample. Okay. And again, this is going to amplify the DNA via the PCR technology. And so this is really going to give us a much more rapid result. All right. So let's move on to the next topic right here. We are going to talk about the treatment. And so you will see that there will be a what we call as first line of medications, and there's also the second line, and a treatment for those patients that have the latent type of tuberculosis infection. Okay, so for the first part here, we'll talk about the standard regimen. Okay, and this is indicated for those people that have susceptible TB. It simply means that the kind of tuberculosis that they have is not resistant. Okay, and with this standard regimen, you will see those common anti-tubercular medications. And so this will also require the person to undergo at least 2 months of intensive anti-tubercular management. And this will be followed by another 4 months, which is going to be a continuous phase of the pharmacological treatment of this patient. So we'll see here, the first and foremost, we have the INH, known as the isoniazid. Okay, so what is this medication? Well, of course, this is one of the first line medication. Another is we have the rifampin, and I will talk more about each medication. and we also have the PZA or the pyrazinamide, and we also have the ethambutol. All right. And in some books, you might see the streptomycin, but no, it doesn't really belong in this kind of category. All right. And so this is what we call as the ripe. Okay. We have the rifampin, we have the isoniazid, we have the P for the pyrazinamide, and E for ethambutol. So that is the ripe acronym. Okay. So what is really the purpose that the patient will start with these 4 medications? Well, the isoniazid itself, it is effective in inhibiting the synthesis of the mycolic acid, which is an essential component in the building of the bacterial cell wall. And so the isoniazid will prevent this synthesis. And now it is going to be effective when it's being given with the other anti-tubercular medications. But you have to be very careful here because this medication alone is going to be hepatotoxic. Okay, it can harm the liver, it can lead to hepatitis, and in severe cases, the patient will go into seizures and neuropathy. Okay, so again, neuropathy, seizures, hepatotoxicity, these are the major adverse or side effects of these isoniazid. So what are we going to do before we start the therapy for this patient? Well, it's very important that we are going to screen the patient and make sure that there is an order for us to get the baseline levels of their liver enzymes. What we call them is the LFTs, liver function tests. So this includes the AST and the ALT. So these are the important enzymes that we need to take a look before we initiate or before the patient starts taking the medication. And then at least every 2 to 4 weeks once they have started the medication therapy. Okay, so again, we need to have a baseline study about the liver function, and then every 2 to 4 weeks once they are undergoing the therapy. Now, since the patient will also have the neuropathy, there will be an alteration in their nerve function. There will be some alteration in the sensation. There could be some numbness, prickling, tingling sensation in the lower extremities. Then this will be prevented by the administration of vitamin B6. We call this as the pyridoxine. Okay, so this is a vitamin B6. Pyridoxine is going to be added while the patient is taking the INH. Now guys, if in case a person will end up with the liver toxicity or hepatitis, well, the provider will often discontinue the medication and will allow the liver to at least have some time to heal, and this will now be replaced with another type of anti-tubercular medication that is less hepatotoxic, and so that can be the course of the therapy if in case they're gonna have the hepatotoxicity. All right, again, first thing is to allow some healing for the liver and then resume the anti-tubercular therapy with less effect onto the liver. Now we're going to talk about the rifampin. So what is the rifampin going to do to the bacteria itself? Well, it can also inhibit the bacterial RNA synthesis. It will inhibit the bacterial RNA synthesis, and this is going to bind to the beta subunit of the DNA, which is the dependent RNA polymerase, and it will also block the transcription. Okay, so it will not be able to really multiply inside the body, and that's why the rifampin will be effective in the treatment as well. But guys, take note that the medication itself has some adverse effects or side effects, and one of those is the expected orange urine, and this is something that you need to include in your patient teaching. Let them know that they will be seeing that orange coloration, and if they are unfortunate, they're going to be getting the hepatotoxicity as well, elevation of the liver enzymes, and they might also complain about some flu-like symptoms. So probably they're going to be in bed for quite some time if they're having the hepatotoxicity unreported for quite a while. So this is something that we need to address immediately. Now, what are we going to do if the patient will be taking the rifampin? Well, we are going to at least obtain that baseline information again about the liver enzymes. And periodically, once they start the medication, we're going to have the every 2 weeks up to every 4 weeks monitoring of the liver function test, which are the includes the AST and the ALT. Now, the same thing, if they're going to have the hepatotoxicity with the medication will be discontinued and will be replaced with another type of anti-tubercular drug. All right. And with the next medication here, we have the PZA or the pyrazinamide. So what is this drug? Well, it can also disrupt the bacterial cell membrane. Okay, so it will target the bacteria cell membrane, and also it can impair the transport and also the metabolism inside the cell of the bacteria. Okay, so again, it targets the cell membrane and also the transport of nutrients inside the cell and also the metabolism. So it can halt the growth of the bacteria itself, and also it will lead to cell death. Now, what are we going to expect about the side effect for the PZA? Well, here we go. So these are the side effects. The person will end up with a high uric acid in the bloodstream. So for those people that may have a pre-existing condition, maybe gouty arthritis, then this is going to really aggravate that. So they're going to end up with arthralgia, some hepatotoxicity as well. So that is one of the side effects. Again, elevation of the liver function test or the enzymes. So what are we going to do for this patient that will be taking the PZA? Well, we are going to check for their uric acid level. We're going to have to monitor that at least every month. And there's also going to be baseline checking of their liver function and also periodic testing at least every 2 to 4 weeks. And if it's really going to cause that hepatotoxicity, then discontinuation will happen, and again, replacement of another anti-tubercular medication. Now, for the PZA, this is somewhat kind of like a little bit tricky, especially in the treatment of the susceptible TB. So for example, after 2 months that the patient has been continuously taking the PZA for the susceptible TB type, then the pyrazinamide can be discontinued. And it can vary from one medical provider to the next, but most often the PZA will be discontinued after the isolate has been, or if the type of TB infection that they have is susceptible. Okay. Now, moving forward here with the next medication, which is the ethambutol. What is this drug? Well, this is going to be effective in also treating the TB, and of course, it has it's known to also cause some adverse effects, side effects, such as the optic neuritis, and the person will have a decrease in their discrimination, especially colors red and green. Okay, so please pay attention here. Ethambutol can cause visual impairment and also color blindness, especially for the green and red color. And what we need to have for this patient before we initiate the treatment and while they are undergoing the therapy, they need to have at least baseline and also periodic visual acuity testing, and also with the use of the Ishihara test for the color blindness. Okay, so that's all about ethambutol. Let's move forward here with the next batch of medication. Now we're going to talk about the multi-drug resistant type of TB. So this simply means that the TB bacteria that the patient has right now is resistant to maybe two important medicines. It could be resistance to INH or a resistance to the rifampin. So again, they are considered to be multi-drug resistant if they are resistant to two of the most important medications, such as the INH or the rifampin. Now, if the medical provider here will suspect that the patient has the MDR type of TB infection, then this is going to be based on the person's medical history, whether they where they lived at, or if they had started the treatment even before getting the lab results. And once they know which medications will work, then they're going to adjust the treatment plan. And so it's very important, guys, that not to adjust or add new medication with when the current treatment is not working. And so, guys, these are the medications that we will be seeing, especially with the multi-drug resistant type. So you will expect to see the fluoroquinolone. So this is a type of antibiotic, and we have the two most common ones, levofloxacin and moxifloxacin. So these are your suffixes to identify that they are fluoroquinolones. And so what is the use of, or let's say the side effects rather, of the drug action? We'll talk about the drug action first. So for the fluoroquinolone medication, what do they do to the bacteria? Well, it can also inhibit the bacterial DNA gyrase. It will target the bacterial DNA gyrase. And also the topoisomerase 4. And so these enzymes, let me just write this down real quick. Topoisomerase 4. So these are important enzymes that are actually going to help the bacteria itself. So this is intended for the bacteria to replicate and also to repair the cells. However, when we are administering these type of medications, this is really going to target that DNA gyrase and also the topoisomerase IV. All right, so they're not going to be able to multiply. And another action for the fluoroquinolone against the bacteria is that it will now be able to penetrate the macrophages and also the tissues where the bacteria reside. So this is really going to cause that bacteria to die. Now, naming here the different side effects of the fluoroquinolones. Oh, before we proceed to that, let me erase this. So another group of medications that will be considered as second line drugs. And again, these medications are intended to fight against the multi-drug resistant type of TB. Okay, and another classification will be the cycloserine, and we'll talk a little bit more of that. Now, with the fluoroquinolone, so what is this? This is going to cause some problems, especially GI upset. This can also lead to that problem in the tendon, which I mentioned before. This can lead to tendon rupture. Okay, so guys, for those people that are taking the fluoroquinolone, watch for those signs: tendonitis and tendon rupture. And another adverse effect here is the QT prolongation. QT prolongation is another side effect that you need to keep an eye out, especially if they have a pre-existing cardiac issue. All right. Now, for those other manifestations here, they might also encounter some dizziness and headache. So these are the central nervous system side effects that you need to tell the patient when they start taking this medication. Let them know ahead of time that, hey, you're going to probably experience the dizziness or headache while you are taking the fluoroquinolone. So at least they will give you some information when they're going to experience this. They're going to tell you exactly when they start feeling these manifestations. So what are we going to do here as nurses with these adverse and side effects? Well, we're going to definitely monitor them for the tendonitis and the rupture, and also if they've developed the central nervous system side effects. And we are going to monitor their EKG for the QT prolongation, especially if they are admitted in the hospital. So make sure that we are looking into their cardiac rhythm when they're admitted. Now let's talk about the next classification, or yes, the linezolid. So what is this? This is actually a generic name under the classification of oxazolidenone. Whoops. So that is oxazolidenone, spelled as Oxazolidinone. And this is also an antibiotic that is also effective in inhibiting the bacterial protein synthesis. Okay. Again, its target is to inhibit the bacterial protein synthesis. Okay. And this is going also to bind into the 23S ribosomal RNA. And this is going to prevent the formation of the initiation complex. Now, guys, the linezolid can also do some adverse effects. So, yeah, not a good thing to have. Bone marrow suppression. So when the person will probably develop the bone marrow suppression, well, expect that there will be some drop in their cell counts. We're talking about anemia, could be thrombocytopenia or the leukopenia. So the three groups or the blood cells will drop because of the bone marrow suppression. So that's the side effect of the linezolid. Now, guys, what are we going to do here? Especially the patient will develop these kinds of adverse or side effect. Well, we definitely need to make sure that, oh, there's another one, peripheral neuropathy. So aside from that, they're gonna experience some problems with the nerve function. Peripheral neuropathy will include some problems with their sensations. There might be some disturbances, maybe some numbness or tingling sensation. And also the patient here will definitely need to have some screening, especially with a complete blood count. And make sure that we're also monitoring them for the GI upset, and also there might have that serotonin syndrome as well. Okay. Now, for this patient, we need to monitor their complete blood count regularly, as it can cause bone marrow suppression, and they can really get some more opportunistic infections if their white blood cell count drops, or they'll be prone to bleeding, anemia, once they get themselves injured, or maybe some simple cuts can really lead to prolonged bleeding due to the thrombocytopenia. So we want to make sure that we have these baseline information and periodic testing. Now, we're also going to have to assess them for the neuropathy, and we're also going to educate them for the other side effects, such as in the serotonin syndrome. Now, for the cycloserine, this is a medication that can also cause some side effects, such as seizures. It can also lead to psychosis, depression, and this is another type of medication that we need to monitor the patient for these side effects, especially central nervous system side effects. We have to check for their sensation, because it can lead to peripheral neuropathy as well. they're going to have some altered mental state because of the psychosis. We want to make sure that we are going to assess the patient for their baseline mental state and to check if they're going to develop these changes right after the medication is started. Okay. Now, because the medication can cause the peripheral neuropathy, then the administration of vitamin B6, the pyridoxine, will also be included in the therapy. Okay. Vitamin B6, which is the pyridoxine. All right. Now let's talk about the next type of medication. We have the aminoglycoside. And imagine, guys, we are still talking about the multi-drug resistant type of TB infection. So still, how many medications have we already talked about? There's 3, right? Just for the multi-drug resistant. So this would be the 4th one. So the aminoglycoside, represented by the generic names streptomycin, amikacin, these are very powerful medications and also can become toxic. Okay, guys, what is the action really for the aminoglycoside antibiotics? Well, they are going to inhibit the bacterial protein synthesis, and they're also going to bind into the 30S subunit of the ribosome. Okay, and we are talking about the 30S subunit ribosome of the Mycobacterium tuberculosis. So the medication itself has a killing effect. It has that bactericidal effect. It will kill the microorganism because it is now going to inhibit the synthesis of the protein inside the cell. Okay. Now, guys, like I've said, this is going to be toxic to the body, and we are going to expect that these are going to happen, especially ototoxicity. So what is this ototoxicity? This is basically the hearing loss. Hearing loss. And the person will also can develop some kidney problem here, so it will impair the kidney function, wherein there's probably going to be retention of the waste products, let's say the creatinine and the BUN, and can potentially really cause permanent kidney damage. So you really need to be careful in administering any kind of aminoglycoside. And in my experience with the aminoglycoside administration, it's not really that common. And if in case this is part of the treatment, then there will be levels of the medication that needs to be checked from time to time. It will check for the peak and also the trough in order to determine if the medication is toxic, or to determine if the medication level is still not within the therapeutic range. And so this medication really needs to be monitored frequently in order to prevent any toxicity to the body. Okay. Now, another side effect of the aminoglycoside classification is that it can lead to vestibular toxicity. So what's going to happen to the patient when they have that vestibular toxicity? Well, it can impair their balance. Okay, so there will be unsteadiness. Their gait will become problematic. So when they're probably standing, when you are checking the patient, assessing the patient with the Romberg's test, you're going to stay behind the patient and you're going to ask them to close their eyes, and you're going to start counting for 10 counts or 10 seconds. And once the patients kind of start to wave, or let's say kind of lean on one side, then this is going to tell us that the patient probably has now the vestibular toxicity. It's affecting their balance. Okay, so what is really the vestibular function? Well, remember that this is going to be inside the inner ear, right? And so if this is really going to cause problems into the inner ear, this will now lead into unsteadiness. And this problem, though, can become permanent or temporary. However, though, if the medication administration was not monitored, then the impairment can become permanent. Okay? So please take note of the three major side effects of the streptomycin amikacin autotoxicity, which is the hearing loss, the nephrotoxicity, and the vestibular toxicity about the patient's gait. Now, what are we going to do for this patient? Well, we need to have that baseline hearing test and periodic hearing testing in order to determine if the patient is developing the side effect, and also make sure that we are checking the patient's kidney function, looking into the creatinine levels, the GFR, and also the BUN level to make sure that the patient is safe to continue taking this medication. And then also we need to educate the patient about letting them know what they can potentially experience. So they will know what to report, when to report, in order that we can notify the medical provider. So it would probably call for a discontinuation of the medication if they're going to end up with these toxic side effects. All right. So that would be your responsibility as an RN. Make sure that you are monitoring the patient for these side effects. Now, what are we going to do here? We're going to talk about ethambutol. So this was actually part of the susceptible TB therapy, but also this is going to be included in the multi-drug resistant type of infection. So what is the ethambutol? Well, what it can do is it will target the cell wall synthesis of the bacteria, because the bacteria will have to create the cell wall in order for its growth, right? However, the medication will target the cell wall, and it will now cause the weakening of the cell, and of course it will also inhibit that arabinosyl transferase, which is actually an enzyme that is needed for the synthesis of the bacterial cell wall. And so it has that bacteriostatic effect. It will slow down it has that bacteriostatic effect, and so this is going to slow down the multiplication of the bacteria. Bacteriostatic effect, static. All right, so keep remember that suffix, static. It will slow down the multiplication and also the production of more of the bacteria. Okay, so it will now prevent the bacterial replication. It will not be able to generate new bacteria. So what are the side effects of the ethambutol? Well, this is very important, guys. Take note, it can cause optic neuritis. So what is that? This is an inflammation of the optic nerve, which is basically that cranial nerve that will receive the signals, the impulses coming from the environment. So the optic nerve, once it is become inflamed, this can lead to vision problems, and it can possibly lead to some blindness later on. And also the person will probably develop some more side effects, maybe some gastrointestinal upset, let's say nausea, stomach pain are those manifestations that are under the GI upset category. Now, what are we going to do here as nurses? We are going to make sure that the patient undergo regular eye examinations, make sure that we are teaching the patient to report any kind of visual changes that they will experience once the medication is started. Okay, so again, regular examination is needed. Now, moving forward with the next medication, we also have the pyrazinamide. This is part of the treatment, right, in the susceptible TB. Again, this is a medication that can disrupt the mycobacterial cell membrane and it is going to be really effective in the acidic environment, especially those acidic environment found in the necrotic centers of the tuberculous lesions. So this is really effective for that kind of infection. Now, what are the side effects of the medication? As we had mentioned in the first line drugs, it can lead to hepatotoxicity. It can also lead to an increase in the uric acid in the blood, and it will also can lead to the development of the kidney stones if we are not paying attention to the high uric acid in their blood. Definitely it can complicate to that hyper or the gout or the kidney stones rather. Now the person will also end up some GI upset, so this is something that we need to let them know ahead of time so we can mitigate, we can relieve these manifestations. So what are we going to do if they're taking the pyrazinamide? Of course, the monitoring of the liver function test, the enzymes need to be done in a baseline and also every 2 to 4 weeks once they start taking the drug. We're also going to have to monitor their uric acid at least every month to see if there's elevation and to check the patient if they have any type of swelling or joint pain, because these are signs that they probably have some flare-ups with the gouty type of arthritis. Okay, now moving forward with the next second line defense, we have the ethionamide. What is this medication? This is another medication that can also inhibit the mycolic acid synthesis. It can inhibit the mycolic acid synthesis. So definitely the end effect of this drug is to weaken the mycobacterial cell wall. Okay, so the drug itself can do both effects. It has the bactericidal, it can kill the bacteria, and it can also cause a bacteriostatic effect. Bacteriostatic effect. All right. So don't forget about those twofold effect, bactericidal and bacteriostatic. But let me erase that because I'm going to need the space. So looking forward into the side effect, not really looking forward, but the medication can also lead to hepatotoxicity. That's one, okay? Because there are some more side effects. It can cause hypothyroidism, okay? So this is another manifestation that need to be addressed. So the person will end up with low hormone levels, especially the thyroid gland, and this can make the person so fatigued they're going to end up with some major weight gain, and the person will be depressed. Again, when the person will have hypothyroidism, they can be fatigued, weight gain, depression, and also the drop in their metabolic function, right? So this will influence their blood pressure. Also, the heart rate will go down, the respirations will go down, and we don't want to go into the more severe type of hypothyroidism either. We really want to make sure that this is addressed early on. Now, the other side effects will include central nervous system side effects, such as changes in the patient's mood. They will become dizzy. They probably would be confused around this time. So our care here is to monitor for the patient's liver function test. The enzymes need to be monitored every 2 to 4 weeks, and make sure that we are also assessing their thyroid function. So we're going to look into the TSH, which is the thyroid stimulating hormone. We're going to take a look into the T3, the triiodothyronine, and also the T4, which is the thyroxine. Okay, so these are the tests that need to be screened for this patient that may be developing the hypothyroidism. Okay, Now we are going to monitor for the central nervous system side effects, such as confusion, dizziness, and to make sure that we are reporting these to the medical provider in order to probably decrease the dose if it's really going to lead to a much more severe side effect. Okay. Now, moving forward, we also have another second line medication, which is going to be the para-aminosalicylic acid. Okay. Para-aminosalicylic acid, and this has a bacteriostatic effect. It will inhibit the growth of the Mycobacterium tuberculosis, and it will also stop the multiplication of the bacteria. It doesn't really kill, but it will prevent the multiplication. Okay. Now, the action, which is really to inhibit the multiplication, it will also control the infection, and the medication can also enhance the other anti-tubercular medication to eradicate the bacteria. Okay. So that is why you will see that the patient with the TB will be taking so many other medications, especially if they have the multi-drug resistant type, in order to have a much more therapeutic effect. It will kind of help out the other anti-tubercular medication to be more effective in treating the TB infection. Now, what are we going to expect here for the side effects in the para-aminosalicylic acid? Well, it can also cause hepatotoxicity. It can also lead to GI upset. And so our nursing care here is to make sure we are screening the patient first if they have any elevation of the enzymes, and then periodically we're going to have to look into their LFTs every 2 to 4 weeks as well once they take the medication. And this is a medication that needs to be taken with food as well. Okay, because this can cause the GI upset, and we want to make sure that the patient will be able to tolerate the medication. All right. So guys, have you noticed that most of the medications that we are talking about can really cause some hepatotoxicity? So that will give you an idea now that you have to really focus into the untoward side effects here. Okay, make sure that you are looking into those signs. Now, may I ask, do you still remember those signs of hepatotoxicity? Okay, I just want to know if you still remember. Well, with that, if you are looking into the liver function, of course, there will be elevation of the ALT, AST, right? That is one through the laboratory data. Those enzymes will be elevated. Another is that the patient will develop that jaundice, yellowing of the skin. And not just the skin, but you'll also see the yellowing of the patient's sclera. You can also see that yellowish tinge into the oral mucosa, the buccal side, the nail beds, you can see that, and also the inner aspect of the arm. Yes, you can see the yellowing much more in those areas, especially if the person has a dark skin tone, then those are the areas that you need to look at. The tongue, the buccal mucosa, the sclera, the nail beds. Those are the areas that you're going to look for. The jaundice, especially if they have the darker skin tone. Now, another is that their urine color will be dark. Let me just write it out here. Dark urine. Tea-colored urine. And then they're also going to have a clay-colored stool, pale-colored stool. And just the same as a person with a hepatitis, right? Or let's say a hepatobiliary type of disorder. So basically the person's tinge, let's say the tint rather, I would say, the color of the stools will become pale because there is now a problem in the bilirubin causing that tint. Okay, so instead of going into the GI tract, the pigmentation will now be spread into the bloodstream, and that is why this can become filtered in the kidney and the person's urine will turn out dark color. They have the tea-colored urine. They might also suffer from that skin itching because of the bile salts that may be appearing into the skin layer. So they will have probably some skin breakdown due to scratching. And aside from that, what else? Jaundice, elevation of the liver function, enzymes, urine color, stool color. And for some cases though, with a hepatitis, of course, the right upper quadrant, abdominal pain, that is another one. Okay. Now we're going to talk about the extensively drug-resistant TB. So this is another type of the resistant kind, but this is what we refer now as the extensively drug-resistant, or the XDTB. Kind of weird, huh? Have you heard of this? The XDTB type of infection? So this is a severe form of tuberculosis infection because the bacteria around this time is much more resistant to even the more powerful medications that we had mentioned, including the isoniazid, including the rifampin, the quinolones, the injectable medications. So this is very resistant, and this is really gonna cause the person to have a much more of like short life expectancy, because this is going to be very fatal for the patient, very drug resistant. Okay, so it doesn't respond to any of those medications that we have talked about, guys. And like I've said, it can lead to death, short life expectancy. Now, guys, what are we going to do with this patient with extensively drug-resistant TB? Well, in 2019, this is actually recent. How recent? How many years ago was that? About 4 years ago? Yeah, but I still consider that as recent. Well, the FDA approved this medication called the Pritomanid. Pritomanid. So this is a new medication that has been recently approved back in 2019, and this is going to be useful in the treatment of the XDTB. So this is going to be used for those patients that are resistant to the other medications, and for those people that are not able to tolerate the other regular medications. So this is something that would benefit them. And the action of the medication is to stop the tuberculosis bacteria from making a key part of their cell wall. And so again, this will really kill the bacteria with this kind of medication. And so what are the side effects of the Pritomanid? It can lead to hepatotoxicity. It can also lead to the NVD, the GI manifestations, nausea, vomiting, diarrhea. They're also going to end up with abdominal pain and headache as well. Okay, so your role here as a nurse, make sure that you teach your patient to report these side effects to you or the medical provider, and so we can address and also minimize the severity of these side effects. So what are we going to do here as nurses? Well, we want to make sure that there is baseline information regarding their enzyme function, or the AST, ALT, and periodically we're going to have to check their liver function test as well, every 2 to 4 weeks, to make sure that there is still a safe level of their enzymes. And again, if the medication can cause hepatotoxicity, it will require us to report to the medical provider, and probably discontinuation of the medication, and who knows what will be substituted, right? Because we don't know yet. And so make sure that we are going to educate the patient about the side effects. Exactly. Now, what we're going to do here is to treat these side effects symptomatically. If they're going to have some headache, then we're going to have to minimize those symptoms. If they're going to have some nausea, then we're going to have to treat that with an antiemetic as well. Okay. All right. So that's all about the susceptible TB infection and also the resistant. And we know that there are two groups of the resistant TB. The first one is the what? The MDR, or the multi-drug resistant TB. And the second one is the extensively drug resistant type of TB, or the XD-TB. Now, guys, at this point, we're going to talk about the latent TB infection. So what is the latent TB, or the LTBI? Well, this is what we mentioned earlier, that the person is infected, however, they do not have yet the manifestation. So they're basically asymptomatic. The bacteria is somewhat inactive, okay? It's already present in their body, but they are not sick, and they cannot also spread the bacteria to others, okay? Now, when does the latent TB treatment start? Well, if you're going to ask me, it will now start after ruling out active TB, typically with 9 months of daily isoniazid. Okay, so again, the LTBI treatment will begin after ruling out active TB, and this will start typically within 9 months of daily isoniazid. So guys, you will see here, surprise. So there will be different options about the therapy regarding the isoniazid. Okay, so hello, Nansuli. We have the different dosing schedules here and the frequency. So there's that 300 milligrams per day for 9 months therapy. There's also the 900 milligrams twice per week, and this is going to be taken for 9 months, and this is going to be done with direct observation therapy. It simply means that the patient has to be observed when they take the anti-tubercular medication. That's what it means, DOT, direct observation therapy. Now, there's also an option for the patient to have the 300 milligrams per day for 6 months of therapy, and also 900 milligrams twice every week for 6 months. So it just depends what would be the medical provider's decision, or let's say what they have agreed with the patient. So what works for them, then that would be the option. Now, again, because of isoniazid is really hepatotoxic, we're going to have to watch the patient for the hepatitis and for the neuropathy. Again, what would be our nursing management here? We're going to have to what? Obtain baseline information of the liver function, and also to check the liver function periodically every 2 to 4 weeks. And then for the neuropathy, we will also be administering the vitamin B6, which is the, again, pyridoxine. It will prevent the occurrence of peripheral neuropathy, vitamin B6. Now, we're going to talk about the rifampin, which is another medication that is going to be included in the latent TB. So the dosing here is about 600 milligrams per day times 4 months. And again, it can also lead to hepatitis. So our nursing role here is also to inform the patient that it can turn their urine into the orange color. So they're not going to be surprised, okay? Make sure that they know what to expect. And this is also going to lead them to developing flu-like symptoms. They will get so tired, they might have some joint pains. When they start to have that kind of hepatitis type of symptoms, then we want to make sure that they understand really what needs to be reported. So again, we have to make sure checking the baseline liver function test and periodic LFTs, and possibly discontinuation of the drug if it can lead to hepatotoxicity and allow the liver to heal, and probably would require the medical provider to substitute this medication that is less harmful to the liver. And yeah, lastly, what we have here is the rifampicin. So this is a newer medication in the treatment of for the patient with TB or the latent type. So this is going to be given as a dose of 750 to 900 milligrams, plus it will be added to the isoniazid of 900 milligrams once per week, and this is going to be taken for a total of 12 weeks. Again, that is the rifampicin, and this will be given together with the isoniazid 900 milligrams once per week times 12 weeks. All right. Now, this also can lead to hepatitis. And so, you know, the drill now. Once the patient will develop the hepatitis or hepatotoxicity, your role here is to check the patient's liver function test and periodic testing every 2 to 4 weeks. All right. So I hope that you had mastered those already. Now this time, we are going to talk about the different complications of the tuberculosis. And one of the top complication here is the pleural effusion. And we have already talked about this type of disorder in the last few days ago. This is going to occur when the patient has an active TB, right? And there is now going to be accumulation of the fluid in the pleural space. Again, accumulation of the fluid in the pleural space, and it will cause the patient to have difficulty of breathing. At some point, they're going to manifest chest pain. They're going to end up coughing. And this will really require drainage if the volume is significant, okay? This will require drainage if the volume of the effusion is very significant, that it can cause shortness of breathing. Then it might require this procedure, thoracentesis. Hi Deep. The timing of this live lectures is actually daily, and we start at 9 p.m. Eastern Standard Time, New York time. So yeah, keep an eye out for the next topics, because there will be some more. We're only on the 21st day out of the 90 days. So there will be more topics. And there's also going to be more NCLEX questions that will be presented to you guys. So I really want you to grab that opportunity. All right, back to the pleural effusion. So if this is going to be much more severe form of pleural effusion, if the amount of fluid accumulating in the pleural space is going to cause the shortness of breathing, then the thoracentesis will be required in order to drain that extra fluid, okay? Now, another complication that we will be expecting is the pneumonia caused by the tuberculosis. Well, because there's already an existing infection, so it can also lead to the inflammation, and it will allow the filling of the air sacs with the pus or the fluid. And this can also lead to some severe reactions that is related to the medication or the therapy. So we know already, right? So I hope that you are retaining. So what are those severe reactions to the therapy? We have the hepatotoxicity. What else? What else that you can recall from what I've mentioned earlier? For example, regarding the aminoglycoside, what can you remember about the side effect for the aminoglycoside? Remember about the ototoxicity, the hearing loss, ototoxicity. There is also that what? Nephrotoxicity. And remember about the other one, which is the vestibular toxicity, which is basically going to affect the patient's balance and gait. Let me just write this one as tox to shorten that. Vestibular toxicity, nephrotoxicity, ototoxicity, hepatotoxicity, and it can lead also to peripheral neuropathy. Remember about the INH? All right. I really want to make sure that you're learning today, guys. Peripheral neuropathy. So these are the severe reactions to the therapy that need to be addressed. Now, we are going to move forward in our discussion regarding the nursing care. And so we'll start with the assessment. And this is really going to require us to document the patient's TB exposure and also to check for the active TB disease symptoms. Let's say the coughing that is becoming more productive, the night sweats, the presence of the fever, weight loss, the pleuritic chest pain. Those are the signs that we need to find in this patient, especially if they have the active TB. Now, we're also going to have to auscultate their lung sounds because there will be changes. Adventitious sounds will be common. We're going to have to monitor for their liver function and find out if they are now developing dysfunction because of the drug therapy. Okay, like I've said, we need to monitor this every 2 to 4 weeks while they are taking the anti-tubercular medication. And so, reviewing, guys, what are those liver dysfunction signs? Well, it starts with anorexia, the lack of appetite. They will now be fatigued. There will be joint pain. There will be fever. There will be some right upper quadrant tenderness, which is basically going to point out that the liver has some issues already. There will be clay-colored stools and dark urine. This is the tea-colored urine that I mentioned earlier. There are also going to be vision changes, and there will be nausea. There will be rash because of the itching that they are having because of the bile salts. And also, there will be some persistent hand and also food paresthesia. Okay, and that is why we really want to make sure that our patient is being assessed carefully. So this is just not limited to the liver dysfunction, but also the other system. Now, what are we going to do here, especially for the interventions? We are going to make sure that we are administering the medication in a timely manner. Make sure that if in case the patient will forget the dose, especially when they are in the home setting. So as soon as they recall that, hey, I forgot to take my medication early this morning, they need to take that medication right away before it gets too late within the day. Okay, so this is very important in order to maintain the drug level medication or the drug medication in the bloodstream, and make sure that the patient is taking the drug within the prescribed time, not to stop the prescription if they do not have any adverse reaction, in order to prevent any resistance to the medication. All right. Now, they need to really have some adequate rest periods because we want our patient will be able to fight in the infection. Another is we're going to have to monitor for the patient's breath sounds and also looking into the respiratory rate, their sputum color, the dyspnea, the color of the urine and stool. We want to make sure that we are capturing all these changes because if there is now a increasing adventitious sounds, for example, if there is now increasing sputum production, then this is really going to signal that there is now a worsening of their TB infection. Now, we're also going to talk about the administration of the oxygen as needed, and it's because with the TB infection, this will cause them to have a hard time breathing, and definitely they need to have some supplement, right, to help them get some air. Now, very important, guys, where are we going to place our patient, especially if they're admitted in the hospital? They need to be placed in a private room in that isolation, airborne isolation. Okay, we want to make sure that we are preventing the spread of infection and protecting the personnel as well. Now, part of that would be to implement proper PPE for the caregivers and also the visitors. Make sure that they adhere to wearing the gown, the mask, of course, the N95 mask, not the surgical mask. This is very important, making sure that then when they come into the patient's room, they have to do their hand washing, putting in the proper PPE, and they should not be staying a long time in the patient's room. They have to leave. Who wants the TB infection anyway? And so once they are gonna leave the patient's room, make sure that they remove the PPE accordingly, the doffing of the PPE, and also make sure that they do their proper hand washing as well. And make sure that our patient is taking adequate nutrition in order that they can replenish their body reserves, and also this will help out in the repair of the tissues, right? And it's very important that we are promoting the intake of small frequent meals instead of the large meals, because this can allow them to tolerate the food intake, and we will be able to at least expect much more tolerance as far as taking in. Now we're also going to need to monitor their weight, because if there is a weight loss, that simply means that we are not really attaining that goal. We want to make sure that the patient's infection is treated, because if there is progressing weight loss, that simply means that the patient still has that active infection, right? And we're going to have to include the administration of the vitamin B6, the pyridoxine. This is very important in order to prevent the peripheral neuropathy, right? Peripheral neuropathy. Vitamin B6, pyridoxine. Vitamin B6. All right. Now moving forward here, we are also gonna teach the patient about to adhere and be compliant to the treatment regimen. That is very important, guys, because with non-compliance, it can lead to the resistance to the anti-tubercular medication. Now we're also going to have to monitor the patient for any side effects of the treatment. As like I have said, we have already plenty of those. I'm not going to mention them again. So keep an eye on those manifestations and make sure that those are reported promptly to the medical provider so we can address those issues. Now we're going to talk about the different patient teaching that would be very important, and you might be asked about these patient education once the patient is going to be discharged to the home setting. Now, we are going to definitely encourage them to enhance their home ventilation, okay? So make sure that they are going to open their windows at home, but they need to make sure that their bedroom door is closed at all times, especially if they live with another family member. This should be okay. They should not be closing the door if they're living by themselves, right? But if they live with a huge family with kids around, then it's very important that they need to observe this in order to prevent the spread of the infection, and also to prevent infection to the other family members. And we want to make sure that we are teaching them about coughing and sneezing etiquette, okay? So they need to do this in order to properly dispose the tissue that they've been using when they're coughing or sneezing, and make sure that they're disposing those contaminated tissues properly. And they need to really cover their mouth using the fresh tissues and make sure that they're not spreading those droplets, contaminating their environment. And another is to make sure that we are advocating about household TB testing, especially if there's a huge family in the home. Make sure that they're also going to be screened, because they could have been potentially infected as well. So this is going to be the next step in the treatment of TB. Now we're also going to assess the living condition of the patient. If they have transportation, or let's say their financial status, substance abuse, or let's say their motivation. This is going to be referred to the social worker, because these factors alone can really affect the patient's ability to continue their treatment at home, and also it can influence their ability to follow the medical advice and also their compliance to the treatment. So we want to make sure that these are identified, and if they are present, then we want to make sure that we are consulting the social worker so we can find help for this patient. Now, another is to report new TB cases to the public health. And so we are going to make sure that this is reported to the public health in order that we are going to allow screening of the close contacts, especially for those people who might have been in contact with an infected patient. All right. Now, we're also going to explain the possible complications that they might develop later on. So they will be prepared about these, such as the chest pain, the bleeding, the recurrence of the manifestations. And when they know about the possible complications, this will give them a better understanding and also will help them recognize those manifestations and warning signs. So when they are going to experience these manifestations, they can report to the medical provider promptly and will prevent those serious health issues in the future. Now, we're also going to have to teach them to avoid silica exposure at work, especially like quarries or, let's say, sand blasting or foundries. These are known to increase reactivation of the TB. Okay? Reactivation of TB. That is why they need to refrain from getting exposed to silica, especially if their previous occupation, let's say industrial job sites, especially those sand blasting or quarries. Okay, so make sure that they know about this, because again, this can cause reactivation of the TB. Now, we're also going to have to monitor or ask the patient to monitor themselves about the manifestations and make sure that they follow up the sputum testing. Of course, this is very important. They will have periodic sputum testing to see if the bacteria has been eradicated from their lungs, okay? Especially during the early phases of the anti-tubercular therapy. There will be periodic sputum examination to look for the Mycobacterium of tuberculosis. Now, we're also going to have to talk about hygiene, which is very important. Address crowded home situation, also poor ventilation in the home. This is also going to be important. Another thing is to make sure that there will be regular symptom check and also chest x-rays, especially for those patients that they might have the latent type of TBI. And this is going to be done periodically as well in order to monitor for the patient's progress. Now, there is a need to have that prophylaxis, especially with the INH for those high-risk groups if they have that LTBI kind of infection. We want to make sure that the patient is educated on the PPD testing, okay? And especially for those patients that are asymptomatic. So they need to really be taught on getting that periodic PPD testing as well. And so that ends our lecture, guys. And so I hope that you were able to gain some more insights, and I hope that you were able to learn the importance of early detection through symptom assessment and with the use of the different diagnostic testing, especially with the induration. So I really want you to review this part of the lecture if you're not quite familiar with those yet, especially with the pharmacological aspect of the treatment. Also, I hope that you're able to digest those effective nursing care that will also include the pharmacological interventions, the monitoring of side effects, and also promoting adherence to the treatment. Make sure that we are preventing the drug resistance. This is very important, guys. And we need to emphasize as well about the infection control, proper respiratory hygiene, isolation protocol, and also minimizing the transmission of TB. And I hope that you found this lecture helpful. So if you could kindly click the like button for us, so this will be shared with your friends as well. And I highly recommend that you will review this resource and also test yourself with those questions regarding tuberculosis so you can evaluate yourself if you learned something today. And tomorrow we will talk about the nursing care of a patient with lung cancer. Again, we will be talking about lung cancer tomorrow. So I will see you again at the same time, 9 p.m. Eastern Standard Time. So I'll see you again. You take care. Bye-bye.